Colleagues, welcome back. We are super excited that I know many of you are enjoying the summer break, and others, like me, are already deep into our next term. As you're moving forward on your journey, this is what we want you to think about. First of all, you want to consider where are you at using that roadmap, using a blueprint that's going to help you identify exactly what your muddy points are and how you move forward following our 7-week study plan. And if you're not sure what the 7-week study plan is all about, we have you covered right here in the description. If you click on the link, you will see the 7-week study plan. And then the other consideration is you're thinking about where you are on that journey and really mapping it out for yourself, because we know everybody is different depending on where you are on your journey, or maybe you're focusing on becoming a better nurse educator. That's a great goal too. But we want to make sure you're using the study worksheet every single time you show up for a snapshot. Our mission at Dr. Sellars Educate is to support every nurse educator, yes, every single colleague, to achieve certification on the C&E exam and to become a better nurse educator. We believe, based on our mission, based on our purpose, that they go hand in hand. In order for us to achieve that passing score on the C&E exam, it requires us the ability to demonstrate those sub-competencies that are listed in the blueprint that's published by NLN, included in the handbook. It's our ability to truly demonstrate those competencies. So when you get to the C&E exam, you're going to see at least 70%, sometimes even 80% of those questions are going to be aligned at that application and analysis level. So those mid-levels, mid to upper levels of Bloom's taxonomy that are described in pages 188 through 190 in the 6th edition of Billings and Halstead. As you're moving forward on your journey, we want you to truly integrate these evidence-based strategies that we're talking about in our snapshots into your everyday work. That's going to help you feel more focused, feel more competent and confident as you're moving forward on your 7-week study plan and ultimately when you get to the C&E exam. All right, so we're going to start a little different. We're going to use poll everywhere for our thought-provoking question in this snapshot. Okay, so I realize that if you're not live, then you're not able to engage in the poll, maybe at the same level that our colleagues are that may be live. But if you do happen to be live, then you are going to be able to participate in this poll. Okay, so here's the thought-provoking question. What you're going to do, if you all haven't used poll everywhere, is you're going to scan the QR code with your phone, and then it should pop up, okay? Or you have the option of texting 37607, that's the number, and you're going to put in Bridget Cell 263. Okay, that will connect you with the actual poll that we have right now. If you're watching this when it didn't launch live, then it's fine. Just write down what your answer is on your study worksheet. That's printed right here in the description as well. That's going to help you stay focused as you're moving forward in our conversation today, but also when you're looking at your roadmap, your blueprint to success. So here's the question. Which of the following is the primary goal of aligning a nursing curriculum with the program outcomes and learner needs? So we have 4 choices. A is ensuring that nursing students receive a comprehensive education without any gaps in content. Second option is B, integrating core nursing competencies throughout the curriculum to foster teamwork. Option 3 is C, providing diverse experiential learning opportunities to enhance motivation. And option 4 is D, preparing nursing students with the skills and knowledge required for the challenges of the profession. When you're going through all of your questions on the C&E exam, first question you're going to consider, what is this question really asking me? When you're taking the C&E exam, it's very common for the STEM to include a statement or maybe even a scenario, because again, remember that most of those questions, 70% at least, are at that application and analysis level. Okay, so there's context associated with the question that you will be asking. This is why that lowest level of Bloom's taxonomy, you all go ahead and write it on your study worksheet, what that is called. So that lowest level of Bloom's taxonomy, that's why our students can't stop there and we can't stop there as we're moving forward on our journey to achieve nurse educator excellence, because we know we have to go deeper, right? We can't just do the surface learning as described in Billings and Halstead. We have to go into that deep learning phase. That requires us to apply these concepts that we're learning about and analyze, which means We understand the why. Why is it that we're using flipped classroom? Why are we creating those tickets to class? We want to engage students in the learning process long before they cross over into the threshold into our traditional classroom. The traditional classroom provides that structured learning that we know is essential in a nursing curriculum. We also want to engage our adult learners in unstructured learning. Okay, so that is also included in the sixth edition, starting on page 186. All right, so this is what we want you to do. We're going to go a little bit deeper with this question. Okay, so we said step number one, so think about what this question is asking. Step number two, let's just say you have no idea what the question is asking you. The second consideration, what is it that I know for sure about nursing curriculum? Okay, so that's what I want you to think about. That's what I want you to process. Now let's pick this question apart. We're going to go through content, and then just like we normally do, you have to stay to the end because we will take a look at the correct option and the incorrect option. Okay, so this question is asking you the primary goal. The curriculum is a living, breathing framework for us to ensure our students are going to have an excellent nursing educational experience on their journey to achieve their degree, right? Ultimately, that is what the focus and the primary goal of the curriculum is. Now, the second part I want you to think about is how are you, now that you are hopefully kind of debriefing from the spring semester, if you're watching this live, or it could be that you're watching it in the middle of your semester. At whatever point you are engaged in your curriculum, this is what we want you to do. We want you to take time to reflect. Reflective practice is critically important when we're thinking about our journey towards nurse educator excellence. Not only does it help us become a better nurse educator, but it promotes resilience, right? Just like with our students. Oftentimes, as an educator, we get so focused on achieving those learning objectives, making sure our students do well on the Med-Calc exam, making sure they do well on the quizzes, right, to engage in that formative assessment. And ultimately, we want our students to progress and stay on track throughout our nursing curriculum. So this is what we want you to consider. Let's take a look at option A, ensuring that nursing students receive a comprehensive education without any gaps in content. Okay, can we guarantee or even focus on a curriculum that's going to ensure we have no gaps? What can we do though? We map our learning objectives to our program outcomes. We even go deeper, right? We map across the entire curricular elements. That includes our assignments, our quizzes, the learning plans and lesson plans that we're developing for our students, right? And then we map them to the essentials. We map them to our specific standards for our accreditation, right? So we want to map the entire journey of the educational process when we think about the curriculum. B talks about integrating core nursing competencies throughout the curriculum. We know that is essential. It's not enough just to stay at that lowest level of Bloom's taxonomy. We want to engage, just like Patricia Benner's work talks about, in bridging that theory to practice gap. So how does that show up in our curriculum? Well, we want to have unfolding case studies with our students. We want to engage them in learning circles where there's a think, pair, share opportunity, because we know peer learning, just like the research says, is an essential part of the learning journey for our students. What about C, providing those diverse experiential learning opportunities? This is aligned with Kolb's experiential learning theory. His work says that in order for learning to happen, there has to be a practice element. There has to be a hands-on experience that our students are having to truly engage in the learning process. But what happens with the Kolb's experiential learning theory? Students can get stuck, right? Because there's 4 phases that we want to keep students moving through. And we also know that Kolb's work talks about the 4 different categories or types of learners that we have to engage in on this learning journey. So our goal again is to make sure our students don't get stuck. How do we do that? Engage in that formative assessment, giving students real-time feedback so they have a chance to reflect on what went well, what didn't go so well, gather that feedback from us as a data point, make changes to their practice, and then deliver higher quality care. What does that sound like? That's right. If you guess the clinical judgment model, you're absolutely right. It also aligns with the practices that we have discussed related to Kolb's experiential learning theory. And then last but not least, We know that our nursing students have to engage in that cognitive learning domain and also the psychomotor learning domain. So it's not enough just for students to have that knowledge. Yes, we get excited when they pass our MedCalc exam, when they pass our actual exams throughout their journey. And we want to make sure also that they're able to make those safe patient care decisions. Okay, so hopefully those considerations, as we've kind of talked through different elements related to this thought-provoking question, will help you choose the best answer based on your 4 options. When you get to the CNE exam, there are only going to be 3 options, okay? So there'll be just one correct option, and the other 2 will be distractors. What do we know about our distractors? Well, when we're writing our nursing exams, we want to make sure they are effective. How do we know they're effective? It's based on the point by serial index, okay? That is really, it shows us the gap between our high scoring students and our low scoring students, okay? And we always want the PBI for the incorrect options to be negative. Okay, so if you guessed negative, you are correct. That indicates that we have attracted more students who are not knowledgeable about the content, those lower scoring students on the overall exam. Okay, so with PBI, for the incorrect option, we want it to be negative, and the point by zero index for the correct option, we want to be positive. I know you're like, what does this have to do with curriculum? Well, when we're evaluating, really assessing a student's knowledge and exploring that knowledge gap to bridge that theory practice gap, we want students to really understand the blueprint. Okay, we don't give students the blueprint, but this is what we are doing. We're engaging in that formative assessment as part of our teaching plan to ensure students are closing the loop and closing their gaps as we move forward and progress in the scaffolding approach. We're engaging in micro learning every single week, right? We're dripping content into the curriculum, into using those evidence-based strategies to ensure that learning has actually happened. All right, so now let's go back, taking a look at some of the key elements that you want to make sure that you are considering when we look at the actual curriculum checklist. Okay, so you have that in front of you. Let me pull up Prezi and we will get started. So when you look at the actual curricular elements, this is what we first want you to do. Okay, so first, you're going to take a look at the blueprint. Okay, so when you're looking at the blueprint, or looking at the evaluation checklist, you want to be sure that you are meeting each of these curricular elements. Okay, let me see if I can stop sharing one part and then start sharing the next part. All right, so when you're looking at the curriculum, we'll go ahead and share here. The curriculum evaluation checklist, you want to essentially use it as a checklist. Okay, so you're going to print this out and you're going to go through to determine, have I met these curricular elements, and where is this information kept? There are essentially 3 questions you want to consider to verify that indeed you're focusing on the facts of your curriculum and not just the myths or the beliefs. Okay, so number 1, the first element we want you to consider is making sure there's alignment between accreditation standards and our actual competencies in our program. Okay, so taking a look at the 6 different levels of development that happens for your curriculum. We know we start at the top, right? And that's our program outcomes. What is it that we expect our nursing students to be able to do upon graduation? So that's number 1, alignment. Number 2, making sure that it's built around those program outcomes, not only course content. We know course content is essential, right? It is the bedrock, it is the foundation of our curriculum, but it's not the only curricular element we look at. And then third, we know our curriculum is dynamic and it must reflect those evolving healthcare trends. And we know that there are always changes that's happening with our curriculum. We want to be able to truly engage our students using a progressive framework throughout our courses, right? Not just throughout our curriculum, the entire 2-year journey that students are taking for our nursing core courses. But we also want to think about how are we scaffolding that learning week to week, right? Throughout those 8 weeks or 16 weeks in that semester within that term. All right, so now we're going to go back. You're going to do your homework. You're going to use that evaluation checklist that we just looked at, and you're going to make sure that you are not only clarifying any points that you have about the specific elements that are listed. There we go. I don't know why it wouldn't work at first. You know, that's That's the great thing about technology, right? It's great when it works, and when it's not, not as much. So this is what we're trying to do. We like the screen on screen option because that increases engagement. Anytime you're doing an asynchronous session, it's always a great idea if you can be in the same frame as your content, knowing that it doesn't always work that way, such as with technology. All right, so this is what we're talking about. Number one, again, the accreditation standards. Number two, program outcomes, making sure there's alignment. And number three, we have to watch those evolving healthcare trends. All right, excellent. So now we're going to go back and take a look at the thought-provoking question, and let's see how you all did as we wrap up our time together today. All right, so if you chose the correct answer, I want you to reflect on what attracted you to the option D, which is the best answer. Okay, so we already did a little bit of a deep dive into the rationale for the other three options not being correct. D is the most comprehensive option because it absolutely explores and really aligns with the question, right? It explores what is it that our students must know when we think about the nursing curriculum and the program outcomes and what our learners' needs are, right? We know that in healthcare, there are challenges that our students are experiencing, and we know that it is impossible to teach everything, but we have to be focused on what is it that our students must know in order to ensure that our program outcomes are met, students are able to pass the NCLEX, and ultimately they're able to make safe patient care decisions when they do transition into independent practice into the healthcare setting where they choose to work. Our mission at Dr. Sellars Educate is that we will help you move forward on your journey towards nurse educator success and help you stay focused as you move forward in achieving that passing score on the CNE exam. The only way that you will not be successful on the CNE exam is if you quit. We are here to support you until you are successful, no matter how long that takes. We look forward to seeing you in our future programs. We have a lot of exciting ones coming up. So make sure you check out our website, drsellarseducate.com. We'll see you in the next snapshot. Have a great one, everybody.